those that have left their families and worked incredibly long hours in challenging conditions, responded to emergency calls for assistance, have staffed Emergency Operations Center and Incident Command posts across the state, as well as our critical healthcare facilities, to keep all North Carolinians safe. Thank you for what you do every day to protect the 10.8 million people that call this great state home. We are truly lucky to have such outstanding first responders and public safety professionals in North Carolina. This disaster is unlike anything our state has ever experienced. As we said at the beginning, North Carolina is strong and resilient, and we will get through this together. A note to our media partners listening. Unfortunately, our teleconferencing system is experiencing some technical difficulties this morning. For media listening in remotely, if you have questions about today's press conference, please email the Joint Information Center, and your question will be answered immediately following this press conference. Thank you.
Thank you, Director Ray. Now I'd like to ask FEMA Administrator Criswell to share an update.
Thank you, Governor, and good morning. Yesterday, the Governor and I had an opportunity to brief both the President and the Vice President, and I just want to share that their commitment to making sure all federal resources are available to support this response were articulated again and emphasized. And so I have committed to the Governor that I will stay here until the event is stabilized, and we will continue to bring in as many federal resources as are needed, not just for this ongoing response, but as we move into recovery. We have had resources here on the ground since well before the storm had impacts. We moved resources like our search and rescue teams and the Army Corps of Engineers. We have healthcare medical assessment teams, and now we have the medical assistance teams in the hospitals. And we have aviation assets and communication assets that we have brought in. We continue to bring in more resources as we identify additional needs, but also to anticipate what is going to be needed to sustain this level of operation for the days and the weeks to come. And so, Governor, you have my commitment to make sure that we continue to bring every resource available, that we think creatively about the type of resources that we have, and that we make sure that there's no delay and we eliminate any bureaucracy in trying to engage them into this flood flight as well as the recovery operations. And I just want to close by reiterating that you can apply for federal assistance. If you have had impacts to your home, if you have been displaced, if you have lost your food because of a power outage, but you don't have damages to your home, please register for assistance. You can again do that at disasterassistance.gov. You can download the FEMA app. You can call 1-800-621-FEMA. But we also know many people don't have communications right now. And so we are also sending our disaster survivor assistance teams into the shelters to begin with to help register individuals. They will begin to go into the neighborhoods as it's safe for them to walk around. If you see somebody in a FEMA shirt, ask them if you can register. It might be one of those teams, and if not, they'll be able to direct you to where you can. And so, Governor, again, you have my commitment from the entire federal family to ensure you have any resource you need to support this ongoing effort. Thank you.
It shows the magnitude of this disaster to have the head of FEMA here on the ground so long, and that commitment from FEMA, so we're grateful for that. I'd now like to ask Major General Todd Hunt, the Adjutant General of the North Carolina National Guard, to share his report.
Thank you, Governor, and good morning. And I want to also thank the citizen soldiers that are out there and airmen with their dedication and service as we propagate through this crisis. I want to give you a couple updates on what the National Guard is doing. Right now, we still currently have 800 guardsmen on duty with 275 vehicles. Those numbers will increase throughout the day. We are running two simultaneously operations with our emergency management partners, with DOT and North Carolina State Highway Patrol. Those two operations are one by ground and one by air. Right now, our ground forces, or our soldiers on the ground, have pushed further into the western part of the state. And by this afternoon, we should have guardsmen in every affected county, along with a liaison officer in these counties to help with communications, commodity distribution, and getting a sense of what is actually going on due to some of the lines of communication have been broken. Our air operation continues to operate, like the governor said yesterday. We delivered almost 200,000 pounds of food and commodities out of the Asheville airport. Right now, we're currently operating with 21 aircraft, and we have more on standby and some coming in this afternoon to help with this problem set that we have. I also would like to thank our civilian partners that are out there as well. Like I just mentioned, this is a team effort with emergency management, our Highway Patrol, our DOT, but most of all, thanks to the citizen soldiers that are out there every day. Some have not been home to their houses that have been damaged and are helping others. So thank you, Governor.
Thank you, sir. I'd now like to ask our Transportation Secretary, Joey Hopkins, to share an update.
Thank you, Governor. As Governor Cooper mentioned, we were in Western North Carolina yesterday, and we saw firsthand some of the devastation that they are experiencing out there. And our thoughts and prayers go out to all affected people. I want y'all to know that we're working day and night to remove trees and debris from the roads and highways. We have crews from across the state and contractors working just as hard as they can to do this. Unfortunately, some of our own employees are experiencing the same struggles as our citizens of Western North Carolina. They have limited access or no access to food and water, and sometimes even fuel issues. We're sending supplies from other parts of the state so crews can continue to working on our roads, and we're working with other states to bring in other assets, such as temporary bridge materials, to assist in reopening damaged roads. And we're thankful for our partners in Florida for doing this for us. We've had many states reach out, our partners across the DOTs reach out and offer assistance. Right now, we have roughly 1,600 employees and over 75 contract crews directly assisting with these efforts, and more on the way. We have secured a location in Flat Rock to house up to 250 NCDOT and contract workers that are assisting these efforts, and we're hoping to move more people in as soon as we can increase housing. Due to communication and access issues, the ability to collect and even disseminate information about road closures has been hindered. We believe there are more road closures than are shown on the Drive NC website. However, that's the best information we have at this time. This morning, we're reporting 425 road closures, and we have already identified over 700 damaged sites. However, we're starting to see some progress on clearing, repairing, and even opening roads. Eastbound I-40 near Old Fort has now reopened, and we hope to reopen westbound I-40 in that same area today. I-26 is open throughout the state of North Carolina, and 421 is open to Boone and even past Boone toward the Tennessee line. However, we've got I-40 closed at mile marker 3 at the Tennessee line, and it will be for some time due to the extent of the damage. We're already looking at some options to stabilize the road that's left there, so hopefully we can start repair just as soon as possible. At this time, we're still recommending a limit on travel in Western North Carolina unless it's an emergency or you are assisting with recovery efforts. Travel in this area for non-emergency personnel is hindering needed emergency response. Also, I'd like to remind you, food, water, and even fuel is in short supply. So any additional needs on those resources hurts us too. We have issued emergency cellular alerts to motorists near the I-40, I-77 interchange, alerting them that travel is prohibited in Western North Carolina and that we only want emergency or local traffic past that point. I do want to thank the Highway Patrol for manning that interchange for us during this closure. That was a huge effort, and I want to thank them for that. Our top priority is to open as many roads as we can so residents can get the supplies they need, and our utility partners can reach areas to repair their own infrastructure. I want to thank our many partners that are working along with our state to help alert motorists of dangerous road conditions and are also helping to clear trees and debris from the highways. There are many state partners that are helping in this effort. Some are like the North Carolina National Guard, the State Highway Patrol, local law enforcement, other first responders, and even private citizens are helping in those efforts. Our crews and staff are dedicated public servants and will remain working until the last road is reopened and travel is restored. This is one of the most catastrophic events, like has been said, that our state has ever seen or even that we've seen in our lives. Recovery will take time, and we appreciate your patience as we continue to assess and repair the roads and highways in western North Carolina. Thank you.
Thank you, sir. We'll now hear from our Health and Human Services Secretary, Cody Kinsley.
Thank you, Governor. The entire team at the North Carolina Department of Health and Human Services has made the health and well-being of Western North Carolinians our top priority. We are supplying and supporting healthcare facilities in the region, coordinating and staffing shelters across the state, and making it easier for people to get access to food and healthcare. There are 22 acute care hospitals in Western North Carolina. We have connected with every one of them to understand their power, water, food, medical supply, and staffing needs. As of this morning, 20 are on commercial power. The remaining 2 are on generator power. Many hospitals in the region are still on temporary water. We have activated 2 federal disaster medical assistance teams to help emergency departments at Mission Hospital and Blue Ridge Regional Hospital. With the large number of people that are showing up, we'll continue to support them with more support on the way. There are 91 nursing homes and 121 assisted living facilities in Western North Carolina. We have connected with each of them as well and are staying in close contact to ensure the safety and well-being of our elderly and disabled. Many of the facilities are still disconnected from commercial power and municipal water. We are supporting these facilities with the resources they need to support their patients and residents. We have supported 4 facilities in the region to transition patients and 3 more facilities in the region as well to other facilities in the state. For all healthcare facilities of every shape and size in the region, we are working with emergency management and the National Guard to use road and airdrops to get food, water, fuel, and other supplies to these facilities as quickly as possible. 6 water tankers and 4 large water storage units have been deployed to facilities, and over 190,000 pounds of food, water, and medical supplies have been delivered or airlifted to several locations, including critical healthcare facilities. We have activated statewide patient coordination and transfer systems using land and air assets to move critical patients to reduce pressure on Western facilities. Over 220 ambulances and 520 EMS personnel have been deployed to support patient movement. We know there is a significant need for oxygen in impacted communities. We have distributed 3 large shipments of oxygen and are working to secure more. We are also working to get oxygen available at centralized locations for individuals that are at home and oxygen dependent without power. Public health nurses have been deployed to help in shelters, and environmental specialists have been deployed to western counties to conduct re-inspection so that flooded restaurants and hotels can reopen, and to assist with testing of private drinking water and wells to ensure that they are safe to operate. I want to remind people in Western North Carolina that drinking water may not be safe to drink from municipal sources or well water. Flooding damages infrastructure and wells with contaminants. Only use bottled, boiled, or treated water for drinking, cooking, and personal hygiene. We have 29 open shelters with over 1,000 people in those shelters. Those are being staffed through a combination of our state staff, county staff, and teams from the American Red Cross. We are working with the Department of Social Services in each county and public health offices in eastern North Carolina to identify additional volunteers to support Western shelters. We have 3 fixed sites delivering food to 30 different locations across Western NC. These deliveries are to shelters, fire departments, and churches throughout the region. We delivered 20,000 meals yesterday. We are working with our federal partners to automatically replace lost food for people who receive SNAP benefits and getting flexibility so that people with SNAP benefits can use those resources differently. We're also working with federal partners to temporarily provide food benefits to individuals and families that have been impacted who do not already receive SNAP. We have relaxed federal and state rules for healthcare facilities so that they can accept more patients when providing temporary shelter for evacuees from other facilities. Also, for people on Medicaid, you can now more easily get reimbursed for necessary services, get your prescriptions refilled early, and expedite nursing home admissions. We will continue to add more flexibility so that providers can act quickly and North Carolinians can get the health care they need. This storm has been catastrophic for so many North Carolinians. I and my team are committed to doing everything we can to help. There is real physical danger, and then there is an emotional toll as well from this storm. It is a traumatic event, and I want you to remember that there is no right or wrong way to feel at this time. If you need someone to talk to, call or text the Disaster Distress Helpline at 1-800-985-5990. Thank you.
Thank you, sir. Thank you, Secretary Kinsley. Now we're going to hear from Attorney General Josh Stein.
Thank you, Governor Cooper.
If you're just joining
First,
us,
I want to
officials
extend my
in North
prayers to
Carolina
all the
giving us an
people
update
impacted
on
by
the state's response to Helene. There is an extensive effort by air and land to help people impacted. Meantime, officials are asking people to stay off the roads. There are more than 400 road closures right now, but officials believe that number could be much higher. This is as conditions on the ground remain extremely dangerous due to down power lines, flooding, unstable grounds, and the danger now of landslides. President Biden has directed FEMA's director to remain in Western North Carolina until the state stabilizes. This is to help direct the federal help that is needed. In addition to that, we heard officials here thanking 22 states and more counting that are offering help and assistance in North Carolina. And we've also heard this from other governors and other state officials of those states that are impacted. Right now, sadly, the death toll across the Southeast is climbing, surpassing 130, and hundreds remain unaccounted for. In North Carolina specifically, there are dozens of search and rescue teams on the ground working to help locate people, and more than 800 National Guard soldiers on the ground as well, helping with distributing food and other goods. We, of course, are continuing to follow the latest on the response to Helene across the Southeast. We'll bring you updates as they're available. You are watching Local News Live. I'm Nicole Newman.
In the wake of Hurricane Helene, countless families are facing devastation and loss.
One of the worst storms in modern history.
And when nature does its worst, we do our best.
It's a family of 3 has been rescued.
You can help. Scan the QR code or go to HeleneHelp.org to help provide immediate relief. Join Local News Live and Gray Media and support Hurricane Helene relief. Together, we can rebuild and restore hope.
One of the most important elements of caregiving is taking care of yourself.
Visit aarp.org/caregiving for a free military veterans guide to navigate your caregiving journey.
Local News Live, always streaming, always free.